Hey everyone, my name is Megan Withrow and I'm a sophomore here at Thomas University. This presentation is for my fall 2016 Criminology 150 class, who is taught by Professor Lori Battle. I am going to talk about mental disorders and how they relate to crime. Psychologists and psychiatrists have long debated the origin of mental disorders and mental illnesses. Children growing up in abusive homes may be rewarded by not getting beaten if they learn to be quiet. This is a condition that often leads to clinical depression in adulthood. Offenders suffer from a wide variety of mood or behavior disorders. This is causing them to be depressed and antisocial. Some offenders have been diagnosed with a form of mood disorder. Mood disorder is a condition in which the prevailing emotional mood is distorted or inappropriate to the circumstances. This is a category of illnesses that describes a serious change in mood. Mood disorders include depression, bipolar disorder, and ODD. Symptoms of ODD include frequent loss of temper, constant arguing with adults, denying adults or refusing requests or rules, and deliberately being annoying to others. ODD has been linked to many social problems, including delinquency and bullying. Adolescent boys with antisocial substance disorder, also known as ASD, repeatedly engage in risky antisocial and drug-using behaviors. Children diagnosed with conduct disorder, also known as CD, have difficulty following rules and behaving in a socially acceptable way. They are viewed by others as severely antisocial. Research shows that they are frequently involved in activities such as bullying, fighting, committing sexual assault, and having cruelty towards animals. Schizophrenia is a serious form of mental illness, a psychotic disorder marked by hearing non-existent voices, seeing hallucinations, and exhibiting inappropriate responses. For people who have schizophrenia and don't seek treatment, the result is far too often that they end up homeless or in jail because of a minor offense. People with schizophrenia are more likely to harm themselves than to be violent in public. Violence is not a symptom for schizophrenia. Drug and alcohol abuse raise the risk of violence in people with schizophrenia, particularly if the illness is left untreated. When violence does occur, it's more likely targeted at friends and family members. The majority of people with schizophrenia who are in jail have been charged with misdemeanors such as trespassing. Bipolar disorder is another serious form of mental illness along with schizophrenia. Bipolar disorder is an emotional disturbance in which moods alternate between periods of wild elation and deep depression. The prognosis and course of bipolar disorder is worse when there is a history of trauma. Research has shown that in patients with bipolar disorder, more than 50% report childhood abuse. People who suffer from prior social problems, such as child abuse, may be more likely to commit criminal acts, use drugs and alcohol to cope, and to suffer a mental illness. Living in a stress-filled environment may produce symptoms of both mental illnesses and crime. Also, the police are more likely to arrest the mentally ill, which gives them the impression that they are crime-prone. People with severe mental illnesses are more at risk to violent victimization than the mentally healthy. Violent victimization has been linked to increased crime rates. Those suffering mental illnesses may self-medicate by using illegal substances, which is a practice linked to criminal behavior. With all of that being said, mental disorders and mental illnesses are closely linked to criminal acts. I hope you've enjoyed my presentation. Thanks for watching.